I'm spending more time with my doctor and with other people around that are having similar symptoms. It's just like a family.
You and I had to come business with the clinics company.
I know what you're going through. I can relate to that.
Oh, yeah, I'm constantly having...
Before I started doing DIGMA, my practice was on a day when I was there full time that I would see 25 up to 30 patients in that period of time, in addition to trying to answer phone calls and whatnot. DIGMA really has allowed me to open up my practice, if you will, by freeing up some appointments in a format that otherwise wouldn't have been done.
The patients that have been coming to the group, it's definitely changed my relationship with them because they see a different side of me, a side that can be a little bit even more aggressive with lifestyle changes and emotional therapy type issues than I can be in the room with them because I have a little bit more time. I'm reinforcing those ideas with patient after patient usually, and I have Deanne, the behavioralist.
I've had all kinds of people in groups, but I could not figure out how it would work to have an eclectic group where you have like a baby and a 90-year-old and how that would work. And it became real apparent after a few weeks that most of our physicians have gone to that very kind of group because it really works best. You can be flexible to the patient's needs, and that other people really don't mind hearing other people's medical issues. And also, we're never as singular as we present ourselves to be.
If someone needs to learn something about their disease, or they need reinforce their good behaviors, whether it's with not smoking or with eating better or getting regular exercise, it's a very good approach because you get all this positive reinforcement from the other patients.
And they learn more effectively sometimes from peers than they do from the paternalistic model that we often promulgate in the delivery of care. And so patients benefit from the model in a number of ways that improves their satisfaction. Also, patients are able to come into the model on a drop-in basis, so where we have problems with capacity and that sort of thing, this is one avenue where patients can seek care in a timely manner, and that also contributes to their satisfaction.
I put ice on it right away, and it's going down, but I have this little puffiness
Let's
here.
look at that. Okay.
Yeah, it's just when I move it, you know, certain areas.
So you felt like your outstretched hand?
Exactly.
Like this? Okay.
Yeah.
Yeah, see that right there? That's where you, reason why you felt, that's where you just experience some bruising. So it's not anything that's deformed. And the way you do it to tell if she's had a fracture, obviously would be if you see some bony deformity.
The other business imperative, of course, is financial management. And if this model can leverage the time of physicians so that they can see more patients in a given period of time and do it more effectively, it really allows us to have physicians manage larger panels of patients without really asking them to work harder. And so from that sense, the model addresses the business need from the financial perspective.
I think that the DIGMA group could be a replacement. Today was a follow-up exam to an examination I had with him in private on Friday. I had no more concern about speaking openly or frankly to him today than I did then.
It sounds like carpal tunnel syndrome is a common symptom. Everybody kind of has probably experienced it at one point or another.
It's become a fun thing for me to do. You know, you can be theatrical, you can be, you know, humorous. It's made practicing much more interesting.
That is pretty good. Thanks. I love when someone at least kind of agrees with me.
As doctors know, when they see a patient, they're hearing about the patient's family, sometimes about the patient's dog, their job, and they really hear a lot about the patient's personal problems. And oftentimes other patients, when they bring this up in group, are the best at helping them solve those problems.
Do you have a question?
What she was saying about the stretching. Stretching is wonderful. The stretching does wonders for the body too, you know.
Oh, it does. It's a relaxation technique.
It's just weird how the patients are able to, you know, draw things out of patients, but us as medical professionals, you know, can't. It's kind of hard to say, oh, come on, share. But when patients say it or do it, they, you know, they feel a lot more comfortable.
Clearly there are some people that don't want to talk about their personal life in front of other people. Although a majority of people, I am shocked to find, love to talk about their personal life in front of absolutely everybody.
DIGMA is not for everyone. There are people who really would like to still see their doctor one-on-one. But there are people who actually surprised me in the fact that the reason why they were very skeptical about going to DIGMA, because they didn't want to share their information. But the reason why DIGMA was very empowering to them was they found out that they weren't so bad off.
I felt that I enjoyed it. It was interesting to hear other people's ailments and treatments, and I also think that my concerns are a lot less serious than I had thought they were, because other people are a heck of a lot worse shape than I am most times.
I get it during the day, in the middle of the day.
Is it mostly in these fingers?
Me too. Same thing. Me too.
Yeah.
What she's saying.
Yeah, I get it. And almost, does it feel like it? Yeah, because I get a feeling that it's like from the shoulders.
Feel like your whole hand, your whole arm.
I feel like
numb?
it's being cut off. I don't know how to describe it.
Yeah.
Yeah. Same thing. Yeah.
One of the advantages of the group medical appointments is that patients can come in more often and they can be monitored better. And their medication can be altered in such a way that they stabilize quicker.
It just hurts my wrist.
It just hurts right where I'm tapping.
Yes.
A surgical specialty where they're doing a lot of procedures that would limit the patients that could go. But I think most specialties could find some use for it. At least some subset of their patient population could be scheduled into it.
Frontline people, just like anybody, first looks at this program very skeptically. They say, how can this work? And the first thing they want to do, and physicians do this, I did this initially, is to try to narrow it down to be a certain criteria of people that come in. In other words, you really don't want people that are depressed. You want a very specific kind of patient, one person that doesn't have a lot of problems, when in reality, the more complicated patients are the ones that you really want to see. Those are the ones that the group can help the best.
When I first started doing DIGMA, I was skeptical. I thought, DIGMA sounds like a glorified support group to me, and it wasn't something I thought that I was interested in. I did think it would be very useful in my weight management practice, where I would be able to see more patients and there would be more group education. And then when I started doing the DIGMA, I was pleasantly surprised that not only was it a good experience for my patients, but it also ended up being a good experience for myself.
The group patient appointment program has really been very helpful in terms of finding a better way to deliver care in a competitive environment. We are all challenged with reducing the cost of care, increasing its efficiency, and producing a better product that patients appreciate and feel that they are being cared for in a healing environment.
Where the quality, I think, that really comes in, that the DIGMA provides, that the one individual appointment doesn't, is really the education. The education and the support. A lot of times my patients need more support, that the reason what they come in may be a specific medical issue, but there are just a vast array of psychosocial issues that you don't have time to discuss. And by not discussing those things, I think really brings down the quality of the care. By having the DIGMA and being able to discuss those things really lifts the quality of care to the patient. You're feeling a lot better, but when you start exercising, you get better.
It's something that I enjoyed, and I think I will come back and do it again.
I thought I was all alone in the world with this problem.
These people who are spending 20, 30 minutes with one of the doctors can now spend an hour with the doctor, and maybe the doctor can also see another 5 or 6 or 7 people that hour. And I think from a time constraint issue, it might be good for some of the physicians to actually get involved and do it.
My time is probably better used. I'm able to do all my vitals all at once and be done.
Patients who are resistant to following through with treatment recommendations, getting into counseling and that kind of thing, I think can really be helped.
The physician has a lot of difficulty getting through just the plain data collection as opposed to connecting in a healing environment with the patient in our current model of care. The group patient appointment allows the physician to at least connect with some patients in that group and for other people to observe that. And the physician derives a tremendous amount of satisfaction from having the opportunity to behave in a consistent manner with what's in their heart.
The DIGMA is not about financial incentives. It's really about quality of care and maximizing that quality of care for the patient and the doc.